So there's no doubt that the bottom-up would not be enough to make change, because if we expect culture change to take place through a new generation coming in with new culture and new experiences in their training, and to really lead the change, it won't happen for many good reasons. One, because they're on the bottom of the hierarchy. Many of the bottom-up changes would be blocked by the older generation's, paradigm and sometimes even bad role modeling. And these changes, cultural changes, will take too long if we wait for them to happen via a bottom-up change, which does happen, but it takes longer. Top-down is obviously an important element to be included in any cultural change, since the power of leaders to change institutional culture or healthcare system culture is obviously much stronger than the power of people from the bottom up. So the idea really to enhance the two, to combine the two together via engagement of top-down individuals within the hospital in this activity in two ways. One is trainees, as simple trainees, going as the head of the department, going into a simulation-based training on how to apologize and how to disclose an error. In those times of truth, usually they are the ones who are going to be there in front of families, patients, clients, to deal with more difficult aggressive patients. The more difficult confrontations are usually, we recruit the more senior people. They bring with them a lot of experience. Sometimes they could improve too, not sometimes, always. We can always improve. And by setting the stage and setting the example and come to those simulation type programs, they pave the way for the others to do. That's one way of bringing the top-down people. The other strategy that we at least are finding very, very fruitful is the strategy of bringing the top-down people as instructors. But not only as instructors of these programs based on their experience, but rather engage them in an instructor's course. And part of being engaged in an instructor's course is, of course, to take that course yourself so that you will be better linked with what the course is all about. So you can really build the top-down activity via empowering people on the top-down to be instructors and take a lead in this whole activity.